246,000 new cases of prostate cancer are detected in Europe alone. The data indicate that erectile dysfunction is a significant problem among men worldwide. As many as 43 million men are expected to suffer from this condition in Europe by the year 2025. Shame and undetected symptoms are among the key reasons why many Europeans neglect to seek medical help when experiencing urological complaints. Urology Week, organised on the 14th and 15th of September last year by the EAU, proved to be very successful in encouraging men to seek medical help, and no less than 23 countries participated in this event. Organised annually, the Urology Week targets the most pressing issues of the prostate disease, erectile dysfunction and man's sexuality. Professor Abrahamsson, Secretary General of the EAU, is here to give his perspective on this international event. Welcome, Professor Abrahamsson. So, what is the goal, really, of Urology Week, in your opinion?
It's all about increasing the awareness that there is help out there for all males suffering of urological disorders. For instance, voiding dysfunction, erectile dysfunction, or any problems affecting not only elderly males but affecting middle-aged groups, males as well, and sometimes even younger males, in fact. So that is what it's all about, and I think there is an educational challenge in that respect, because I wouldn't say there has been too much focus on female problems in the past, but for instance in my country, Sweden, we had very aggressive ladies being involved in politics, and they took a decision in our Swedish parliament more or less overnight in the 80s to introduce mammography. And it was not a wrong decision in my opinion, but there's been a lot of focus on breast cancer, for instance, over the years, and very little on prostate cancer, for instance. And now, since 10 years, new treatment options for erectile dysfunction, for instance, it should be our ultimate goal actually to educate not only our colleagues out there around Europe, but also the male and the female population.
Yeah.
The
so a lot of people are affected by this one way or another, aren't they, really?
Oh, we're talking about millions and millions in
Right.
Europe, all over Europe and across the world, absolutely.
Yeah. Now, what activities are usually organised within the Urology Week?
Well, we try from our central office on behalf of the EU organization to stimulate national organizations, but also patient organization to really send out strong messages, but also to educate and improve the awareness among the male and the female population that there is help, there is an opportunity to get support from the health institutions we have available around Europe.
So going back to the patients themselves, how do people access the information easily?
I think so far, I mean, when you're looking at the older generations out there, they are not that keen to perhaps use the internet, but otherwise for the future, internet would be the optimal solution to reach out in terms of information, education, what we call e-learning. But for the older generation, we still have to use newspapers, television, radio, and also face-to-face meetings, so to say, in order to reach out with our strong messages.
Yeah, so then that goes back to the practitioner's approach.
Exactly,
does that?
exactly.
Yeah.
But the aging male and the men's health awareness is increasing now. There's no doubt about it. So I think that Urology Week has been very successful, and we started only a few years ago. But
yes, indeed. Yeah.
and during this meeting, I can tell you, even our friends in Latin America, like the Mexican colleagues we met the Mexican board the other day, they want to get access to our educational material, how to reach out to their population in Mexico. And that is the same phenomena when I met actually representatives from Asia during this meeting, and also representatives of South America, that they know that we are now trying to improve overall knowledge in Europe and awareness of urology as a whole, and they want to do the same thing in their countries respectively.
Right. Will there be any not co-productions exactly, but will you be doing research hand in hand with other countries as well? Is that something that's been planned?
Absolutely. I mean, in that respect, this meeting in particular has been extremely successful, because we are now initiating a number of events with the entire globe, more or less. Rapidly growing countries like India and China, Brazil, Argentina, Mexico, as I mentioned earlier. So we are turning into a global organization, no doubt about it. And in that respect, we are also responsible for not only education, but also the surgical training, but also improve the overall awareness of urology, what we can do in order to reach out to males and females on the street suffering of urological diseases.
And also, within your own experience, what are the main misconceptions that practitioners, the public, patients have about urological conditions?
No, I think in general most people, they know very little about our speciality, unfortunately. They think perhaps that it's only about catheters and avoiding problems, get rid of urine from your bladder. So there's a lot of misconception, and they don't really know that much about urology as a whole, that we are actually not only involved in bladder dysfunction or prostatic problems, but also in taking care of infertility,
yes,
erectile dysfunction, urinary tract stones and complicated infections in the urinary tract, and of course all the cancers we're talking about here, testicular, penile cancer, bladder, kidney cancer, and of course prostate cancer.
So total awareness, really, that's one of the goals of the Urology Week.
Absolutely, to really improve the overall understanding what we have been able to achieve in our laboratories, and how we've been able to transform that kind of information all the way out to the patient. And also the new drugs now available, for instance, as we discussed earlier, to treat erectile dysfunction.
What did you expect in the future from Urology Week? If you had a wish list, you've got your crystal ball in front of you, what would you really like to accomplish with Urology Week?
Well, you're asking too much, actually. I would like to be on all televisions or media available out there,
world domination,
and tell the world what we can achieve together, actually, in terms of all the disorders we discussed here today, and all the achievements we have been able to really accomplish for the last 10 years, and that's a lot, actually. And just as an example, testicular cancer was something people were dying of 25 or 20 years ago. Now we can treat almost all of them and cure them.
The survival rates are fantastic.
It's fantastic, close to 100% now. So you see, I think most people, they don't know about that. For them, cancer is so loaded, and we should actually tell them that we can cure most of these tumors now. The increasing awareness of that we can find prostate cancer at an early stage and then cure it. That is something that will be very, very, very much debated the next coming year. As we discussed the other day, of increasing awareness of that the screening makes a difference of prostate cancer, but also the other malignant disorders we discussed earlier as well, that we have better and better treatment options to show our patients.